Well, difficult place to try to summarize. First of all, I would like to say thank you. Thank you for this fantastic venue and setting. I was quite impressed. I thought while I was approaching with Minister of Health that it was an Oscar ceremony. I was listening, and the winner is, of course, the winner is health. And we are all the winner, it means. And frankly speaking, it was a fascinating discussion. It really highlighted the importance to take responsibility. And I was particularly struck also by the images of this globe. You know, the images that you took, how is it called? The kintsugi? The kintsugi, the Japanese art of mending broken pottery with gold. I think that we can fill these fragmentations, this fragmented world, with something beautiful, with something precious. Dr. Tedros said it in German, but I can't, I'm sorry, but thanks to you I had the translation. It's health as a human right. Yes, our systems, our societies, even our trust have been fractured by crisis, but we are repairing them. And together, we are making them stronger. Dear friends, I would like also to focus on two areas from today's discussion: responsibility and cooperation. First, we all need to take greater responsibility for global health, because health is where public touches people's lives most directly. And as Minister Warken reminds us, global health is not the task of one government, of one member state, because it's just much more about than managing hospitals or balancing budget. And talking about budget, I took note of the benchmark recommendations, 0.1% or 0.2% GDP dedicated to health. Yes, because the devil is in the financing. I totally agree. Because, yes, taking political responsibility is about doing what is right for people and taking tough decisions, even when it's not popular. It also means choosing cooperation when others are choosing isolation, making sure that Europe's strength at home also helps make countries strong abroad. And we understood that Africa is a big market, indeed, as is a cornerstone of the global health architecture. Because also it's through solidarity and preparedness that we will succeed, because no one is safe until everyone is safe. We shouldn't forget these lessons learned from the COVID-19. Together, we are strong. Alone, we are weak. That was the clear message coming out of Berlin, but also Colombo, Sri Lanka, Nairobi or Brussels. And I took note also that, yes, we need to do it together, all together with the youth as well. As conflict also multiply, climate shocks get worse, and disinformation spreads through the social media, among others. Global health is clearly a moral duty, but it is also a strategic necessity. We cannot be safe at home if we are vulnerable abroad. That's why we are working with our partners to strengthen health systems across our planet by boosting our early warning systems and investing in research and innovation. And that is why also we created the Health Emergency Preparedness and Response Authority, HERA, to make sure we are never again caught off guard. With our new medical countermeasure strategy, we are scaling up our capacity to develop, procure, and stockpile vaccines, antivirals, and therapeutics. We are working with global partners to reinforce supply chains, close surveillance gaps, and make sure that when the next threat comes, No country faces it alone. The same approach runs through our Preparedness Union strategy and the Global Health Resilience Initiative announced by President von der Leyen last month. This shows the EU's deep commitment to strengthening global health security, because the health of our people and the health of our planet depend on three things: collective resilience, shared responsibility, and trust in science. Dear friends, my second point highlights another key point of the discussions: the power of cooperation and international partnerships. These partnerships are not the soft side of global politics. They are the hard core of preparedness. They are the spine that holds everything in place. Yet, disinformation and polarization are eating away at the trust that underpins this cooperation. So we must rebuild this public trust, because it's just as important as building stockpiles. Without trust, even the best systems will fail. That's why the European Commission keeps investing in evidence-based communication, and why making our society more resilient must be at the heart of the global health. Dear friends, allow me to end on a personal note. As a European Commissioner, I visited Ukraine, Syria, Sudan, Chad, Bangladesh, Jordan, and other places where people are hungry, homeless, and desperately ill. But I have also seen how health workers work with communities and partners to save lives and bring hopes. They hold things together when everything else is falling apart. And we should take inspiration from them, from their courage, their perseverance, and their quiet determination to care, even when the odds are against them. And that is certainly why, these health workers remind us what responsibility truly means. Not turning away when things break, but choosing to mend them. They show us that resilience is not built in institutions alone, but in people, in their compassion, cooperation, and shared purpose. So perhaps Kintsugi really is the perfect metaphor for this moment. Yes, our word has some cracks, but it is not completely broken. It needs maybe a transitional period, like Tedros just said. It needs repair, and we will repair it. Maybe not within the 7 months, but we will repair it together, and it will be stronger and more human than before. Thank you.